From my experience, I know a lot of students get challenged with their pharmacology content. And I think the problem, many of them are simply trying to memorize those dozens of side effects of each of those drugs and the indications. But I would say that's not the best way to learn them. And we should understand those medications in relation to the particular disease condition based on the pathophysiology of the disease and how each drug will act in each of the situations. So for example, we're going to look into one such group of drugs we use in the management of migraine headache. And we are going to see why migraine headache need the use of vasoconstrictor drugs. And I'm sure most of you know what migraine headache is. It's characterized by the unilateral, severe, throbbing headache. So let us see how that headache happens. So as you can see here on the screen, what happened is start with the vasoconstriction of the cerebral blood vessels. Again, it's going to start with the vasoconstriction of the cerebral blood vessels, which is going to cause a sense of aura. And I'm sure you know about aura when we talk about seizures more. Kind of similar is going to happen here too. So they can have some sort of unusual visual sensations, what we call as the aura. And so this aura is going to happen with the vasoconstriction. And this aura is going to be followed by vasodilation. And when this vasodilation happens, that's where they go into this throbbing or the pulsating headache. And once more, you start with the aura, which is caused by the vasoconstriction of the cerebral blood vessels. And it's going to be followed by vasodilation, which is going to cause the throbbing or the pulsating headache. So if you understand this as a pathophysiology of migraine, you can assume we might need some medication that's going to control the vasodilation. And that's where we're going to see this list of vasoconstrictor drugs used for this purpose. So let's look into the list of drugs we have used for the purpose. Okay. So as you can see, the first two in the list, they are called the ergot products. Yeah, the very first one is ergotamine tartrate or gynogen. And the second one is ergotamine with the caffeine, which is called a K-ergot. Okay. If you have some recollection, a drug with a similar action is also used in the management of postpartum hemorrhage, and it is nothing but methergine or what we call methyl ergonovin. And again, these drugs all are having the same source, and these are called the ergot alkaloids, which are vasoconstrictors. So it helps with the vasoconstriction and to control the bleeding in with the postpartum hemorrhage, and whereas with the migraine, it helps to achieve vasoconstriction and control the vasodilation, which is causing the migraine headache. And I hope you understood why ergot products, which are vasoconstrictors, are being used in the management of migraine. And then you can see another longer list of vasoconstrictors, again, what we call triptans, and which includes elatriptan, sumatriptan, almotriptan, a drug that students report regularly from the exam. Okay. And as I told you, these are also vasoconstrictors. We already know the pathophysiology of migraine, which is again from vasoconstriction of the cerebral vessels, followed by the vasodilation. So if the patient can identify this vasoconstriction, which is causing the aura in the early stage, they can prevent the attack of migraine, which is happening from the vasodilation. And as I told you, these drugs may appear repeatedly on NCLEX, and how they may ask this, these drugs are strictly contraindicated in the case of a patient with angina, MI, and also with hypertension. And remember, angina and MI is caused by coronary vasospasm, right? Coronary vasoconstriction. So if a patient with that problem take this medicine again, that's going to make their vasoconstriction worse, can increase the anginal pain and can lead into possible MI. So that's why with angina, MI is absolutely contraindicated. And so as for a patient with hypertension, what happened? Hypertension, already their blood pressure is high, and if they take a drug which is a vasoconstrictor, the blood pressure can further increase. And that's why, again, these drugs are contraindicated for patients with the angina, MI, and hypertension. So I hope you got some better understanding of what migraine is, particularly the vasoconstriction followed by the vasodilation, and also why we use vasoconstrictor drugs for the purpose, right? Which can prevent the vasodilation, which is actually causing the migraine headache itself. Okay. If you study your medications with this understanding, whichever way they come, you will be able to answer them in your NCLEX question. You don't have to study those 25 different side effects, which is impossible. So I hope I was able to give you some new insight in your preparation for NCLEX. And don't forget to subscribe our channel. You're going to see a lot more of these useful videos and helpful tips. Thank you.